to me, it didn't feel right. Like, it did, just the full dose chemo. I have three little kids at home, and to be on chemo and to just wreck my immune system just didn't feel right to me. And that's what I didn't want to do. And so I wanted to have hope and not have to tear my body down in order to get better. And that's why I came to Brio, and I feel like that's what I got here. And you do get hope here, and just the staff and everybody's super knowledgeable and passionate about what they do. And coming from me being a nurse, it's very comforting having the staff that they do here. My name is Shay and I'm from Albany, Oregon. So my condition stage was stage 2 invasive ductal carcinoma. So it's breast cancer. And my husband was actually the one that found the lump. Was like, hey, that's not normal. And so I just kind of monitored it for a couple months, and it didn't go away. I didn't really have any pain, like maybe towards the end, but I was also working night shift, and so I was having a lot of just issues just trying to, I was on night shift for 10 years, so my body was just like done. So then I switched to day shift, and I started feeling a lot better. Once I felt the lump though, then I started trying to eat better, and so other than just feeling the lump, I didn't really have many other symptoms. I made an appointment with the doctor, and the doctor did like physical, and the doctor didn't think there was anything wrong, but he decided to order a mammogram and ultrasound anyways. And then I got the mammogram and ultrasound, and after I got that, I kind of knew. I could tell by their faces when they were telling me there was an abnormal that they wanted to get it tested. And so I took that as it was cancer, or I treated it as if it was cancer before I like officially got the diagnosis. He just sent me to the surgeon, and I met with the surgeon, and they told me that they wanted me to do 4 months of chemo, and then they would recommend surgery after the 4 months of chemo. And then depending on what I did, whether I did a lumpectomy or mastectomy, do radiation, and kind of go from there. But I knew right away I wasn't gonna go conventional, or I most likely wasn't going to. I still wanted to talk to everybody, so I talked to the surgeon, and then I talked to my oncologist. And then once I talked to my oncologist, he was just telling me all the side effects, like what drugs I was going to be getting, that my hair was going to fall out. It just wasn't a very great conversation, but it was kind of one that I expected. To me, it didn't feel right. Like, it did, just the full dose chemo. I have three little kids at home, and to be on chemo and to just wreck my immune system just didn't feel right to me. And that's what I didn't want to do. And so I wanted, again, like what you said, to have hope and not have to tear my body down in order to get better. And that's why I came to Brio, and I feel like that's what I got here. And you do get hope here, and just the staff and everybody's super knowledgeable and passionate about what they do. And coming from me being a nurse, it's very comforting having the staff that they do here. I just Googled integrative, or I think I Googled holistic medicine, I believe, and Brio was one of the ones that popped up. And so I was looking at testimonials like this one, and then I actually saw a YouTube video of Dr. Goodyear. I can't remember who he was interviewing with, but I liked his ideology. I liked the way he was thinking, and then just looking at all the different treatments that they have here, I felt like this had the most options, whereas some places you'll get some things but not others, and this one just, I felt God was calling me to Brio, essentially. So for me, it was more just a feeling. Like I felt it was right, and once when I was looking through the different treatments, and how much there was to offer, that really was a deciding factor for me. There's the PEMF, there's high dose vitamin C, I got melatonin. As far as other IVs, DCA, I've got my peptides, mistletoe, infrared, the hyperthermia, which is a love-hate relationship. A love-hate relationship with hyperthermia, but it's really good. There's ozone, there's the Weber. There's so many different therapies here that all work together. Well, from my understanding, I did do low dose chemo, and it's about 10% of the full dose that they normally use. For me, I didn't really, besides getting tired, I didn't really have any other side effect. There was a little bit of a GI upset, but not really much. And so for me, it didn't impact me as much as other people, whereas full dose, I mean, you lose hair, you get nauseous, and there's just a whole lot of stuff that happens when you do full dose chemo. So I feel very fortunate that I have not done full dose chemo. I feel like it has, I can feel my tumor has changed. It's not as hard, it's softer. Size-wise, according to my ultrasound, it hasn't decreased in size as much. Maybe a little bit is what the ultrasound tech, but I am going to go for further scanning. They want me to scan again in a couple weeks, so hasn't gotten smaller, but there's definitely changes that are happening. I just feel better overall. But I was on my way to feeling better anyways, because switching from night shift to day shift after being on it for 10 years was there's a whole different energy level and things that I've had. I would just say to keep your mind open and just know that there is other options out there. You don't have to do what your doctor's telling you. You can get other opinions, and whatever really resonates with you is going to be the best decision for you. I just want to say thank you to everyone at Brio. I wrote a card for all of you guys, so hopefully you guys can all read it. But I just really appreciate all the care, the compassion, and the passion that you guys do have for your jobs. You can all tell that you love what you do, and coming from the medical field, it's been awesome to be taken care of by everyone here.